Marburg virus, which causes infections as deadly as Ebola, has been spreading like a wildfire in Africa. Now, the US Centers for Disease Control and Prevention (CDC) has urged all travelers going to Guinea and Tanzania to take precautions to avoid catching the fatal virus and has issued a warning regarding the same. The CDC is also taking steps to keep infections from spreading to the United States. CDC urged travelers to both countries to avoid contact with sick people and to watch for symptoms for 3 weeks after leaving the area. Travelers to Equatorial Guinea should take enhanced precautions and avoid non-essential travels to the provinces where the outbreak is ongoing, the agency said. In the United States, the agency will post notices in international airports where most travelers arrive, warning them to watch for symptoms of the virus for 21 days and to seek care immediately if they become ill. They will also get a text reminder to watch for symptoms. The CDC is standing up a center-led emergency response. It's not as all-encompassing as when the CDC stands up its emergency operations centers such as for COVID-19 and Mpox, but it will refocus the efforts and attention of the staff of its National Center for Emerging and Zoonotic Infectious Diseases to respond to the outbreaks, which are in 2 countries on opposite sides of Africa, indicating that the deadly hemorrhagic fever is spreading. Equatorial Guinea first reported the virus in February, and since then the WHO has recorded 9 confirmed cases and 20 additional probable cases, all of which have died. According to WHO, Marburg virus disease is a highly virulent disease that causes hemorrhagic fever with a fatality ratio of up to 88%. It is part of the filovirus family that also includes the Ebola virus, which has caused havoc in several previous outbreaks in Africa. The natural host of the Marburg virus is the African fruit bat, which carries the virus but does not fall sick from it. Bats and other infected animals can transfer the Marburg virus. High fever, bleeding both internally and externally, and excruciating headaches are some of the symptoms of the viral illness. After being infected, the Marburg virus can spread to another person by coming into direct contact through cuts in the skin or ruptured mucous membranes with the blood, secretions, organs, or other bodily fluids of an infected person, as well as by coming into contact with contaminated surfaces and materials. Marburg has no known cure or vaccine, but according to the WHO, early candidate vaccines as well as blood products, immune therapies and drug therapies are being studied as possible treatments.